അസ്ഥിക്ഷയം എന്ന രോഗാവസ്ഥയ്ക്കുള്ള കാരണങ്ങളും പ്രതിവിധികളും എന്തൊക്കെയാണ്? പ്രൈം ഹെൽത്ത് കെയർ ഗ്രൂപ്പിലെ വിദഗ്ധ ഡോക്ടർ സംസാരിക്കുന്നു. ഹെൽത്ത് ടോക്ക്. Doctor, what are the common supplements we can use for good bone and joint health?
Supplements as such are only an additive to a normal nutritious diet. So first of all, most important thing is to have a balanced diet between either meat and good fiber content from fruits, vegetables or dates. So as far as supplements are concerned, for good bone health, the most important thing is calcium and vitamin D. So calcium supplements in a normal adult healthy individual should be around 1000 milligram per day, which is called the recommended dietary allowance. Vitamin D, it's common knowledge that we get it from sunlight, but because of restrictions, office habits, sitting in AC for most of the times, we are not exposed to sunlight that much. So that's why vitamin D supplementation has also become necessary, and this is around 400 to 800 international units per day. Now this is about supplements. Coming to the normal diet, it is important to have a good wholesome diet which consists of a lot of greens and pulses as well as nuts. So all of these contribute to some amount of calcium dietary supplements which can be, if taken on a regular intake and in a healthy amount, can prevent you from taking any supplements. So if you are either lacking in these or you don't take supplements, you can end up with something which is called osteoporosis or soft bones. Osteo basically means bones and porosis is softness. Now it is also a myth. A lot of people believe that osteoporosis happens only in elderly individuals or only in females after a certain age. But nowadays a lot of healthy men also have osteoporosis in quite earlier in their age.
So doctor, what is the treatment for osteoporosis?
See, osteoporosis treatment again can be divided into three parts as any other treatment would be. The first would be the diagnosis of the treatment. Diagnosis of osteoporosis can be done through specialized tests. These are called bone mineral density test or DEXA scan. This basically compares the patient's individual's bone health with an individual who is normal of that age as well as an individual of a younger age. So which gives a score which is called the DEXA score, which helps us in dividing the patient whether he is in osteopenia or osteoporosis. Osteopenia is a simpler form of softness of bone in which the bone health is not as good as normal but it is weaker, and osteoporosis means very weak bones. So once the diagnosis is made, usually we put the patients depending upon the DEXA score into these categories and then supplement them with, as I said, calcium and vitamin D. And in severe osteoporosis, if patient has a previous history of family having an osteoporotic fracture or having a steroid intake or is a smoker or alcoholic, in those cases we add an extra medicine. So this medicine would be either hormonal supplements which are basically given for women after menopause, or it could be drugs which maintain or improve the bone formation. So these help in preventing and treating osteoporosis on the whole.